Deaths in custody occur after all of these fatal tortures, or they can be of the physical kind, the physical abuse, if the highlight over here, and then they can be subjected to a lot of different methods that have already been discussed in this lecture. That is the electrical tortures or the suspension phenomena, the asphyxiating conditions, burns. All of these are basically the different methods that the torture is being carried out. Now, after these fatal kind of tortures, death obviously ensues after these tortures. And if death occurs in custody after this person has been subjected to these kind of tortures, it is where the role of the forensic practitioners starts, basically carrying out the investigation in these kind of deaths is sometimes quite tricky in a lot of cases. Sometimes the torture cells are proven to be innocent, and it's basically some underlying cause, pre-existing condition can be the cause to the death, and so one has to be quite vigilant while carrying out the investigations for the deaths in the custody. So we are going to discuss the miscellaneous causes for the deaths in the custody. Obviously, they include the tortures, or sometimes the cause of death is due to the tortures or due to the environmental conditions of the custody, and sometimes the custodial environment is proved to be innocent, and it is some other cause that basically is the underlying factor for the death of the prisoner. So in this section, we are going to discuss the death after the oleoresin capsicum exposure. It's one of the kind of the torture that the people have been exposed to during the torture cell exposure, and it's basically the red pepper, and the biological or the botanical name for that is the oleoresin capsicum, and it's sometimes proved to be fatal for the people. What is the mechanism of action, how it acts, and what are the evidences towards the death due to that exposure, they're discussed over here. Then we are going to basically perform that what is basically the traumatic asphyxia, the AM logs that are common quite practice in a lot of the torture cells, and then the neck holds. It's one of the asphyxiating condition that can also result in deaths in custody. Then we have the positional asphyxia. So it's again very common. Basically, the mugging or the bend of the elbows is used for performing the death in the custodies, and the blunt injuries and the suicides are again very common while the deaths in the custody. Blunt injuries, obviously, blunt weapons are used in these cases, and suicides are after these torturous condition, the person goes into a depressive phase and he or she may commit suicide. So that can also be one of the leading causes for the deaths in the custody. Now, how basically that occurs, it's a meticulous autopsy is being carried out. The necessary part of the investigation is the ill treatment by the relatives or the media. So there is an ill treatment after a person goes into the custody. The media projects the person as a very negative, of a very negative sort, and that is sometimes quite evident. Then there are political issues by hanging or by mechanical trauma, and deaths in custody basically occurs during or after years of the arrest by the officers. So it can be a constant physical abuse, but still the cause of death is the custodial torture. That is the mainstay. So the physical struggle to resist arrest is again going to cause death in the custody. The personal defense sprays can cause again the death of the person. Now, acute ocular irritation. These sprays are sometimes quite irritative for the eyes, and that can cause the eye irritation, that also known as the ocular irritation, lacrimation, and hypothermia. These are the results of this ocular irritation. Lacrimation is basically increased tear formation. That process is known as the lacrimation, and hypothermia is basically the decreased body temperatures. Conjunctivitis is again one of the conditions that can occur after this ocular irritation. It's basically the infection of the conjunctiva, that is known as the conjunctivitis. Now, the blepharospasm is again one of the conditions that the person can result into. It's basically the infection of the eyelids, that is known as the blepharospasm or blepharitis. These two conditions can arise after that. and extreme discomfort of the ocular region. That is the reason over here. Now, after the exposure to the oleoresin capsicum, that is the red pepper, the person can blink quite frequently, or ocular irritation is present in such a condition. Thorough autopsy is being carried out with ancillary investigations, and there is a complete histology that is being carried out in such cases. Toxicological analysis are done, assessment of the circumstances is being carried out. Symptomatology in such cases is quite evident that the person has been subjected to the ocular irritation kind. So this is known as the oleoresin capsicum type. Now, the traumatic asphyxia is one of the kind of asphyxia that the policemen fall upon resisting subject. So that is one of the kinds of the traumatic asphyxia, and the chest compression is one of the leading cause. After that, the traumatic asphyxia occur, the person is unable to breathe, and it's kind of an asphyxiating condition. Prevention of the respiratory movements occurs after this kind of a traumatic asphyxia. Now, AM locks or the neck holds, that are also known as the mugging phenomena, because the neck is being compressed in the bend of the elbows. That is being a part of the arm locks or the neck holds. Now, the compression of the front or the sides of the neck, and after that, it's basically going to the jugular veins and the external carotids are being compressed in the neck. These are basically the basic structures, as well as the trachea. So all of these features are quite evident. Reflex cardiac arrest is basically occurring after this jugular and the carotid compression. So the cerebral ischemia during the carotid compression that occurs, and that is the part of that arm locks. And asphyxia or the airway obstruction are again one of the causes, one of the resulting effects of these arm locks. And then we have the vagal stimulation from the carotid sinuses. So there is a baroreceptors that are present on the carotid sinuses there, and they are going to detect that loss of the pressure, and these baroreceptors, they are going to stimulate the vagal complex, and there will be a vagal stimulation after that. These vasovagal inhibition phenomena or these vasovagal stimulation phenomena, they can result in the cardiac arrest. That are basically the underlying causes over here. The bar arm control or the carotid sleepers are again the mainstay over here, and there is some arachnoid hemorrhage that is quite evident. Then moving on to the positional asphyxia. It's basically after the hog tie, hobble, or the prone maximal strain. Over here, you can see this person. He's basically a drunk person. He's basically trying to get into the house, and somehow he basically hangs over there. And this position is asphyxiating for him, and death ensues in such a case. So it's basically just to show you how positional asphyxia can result in death of the person. And it's quite debilitating in a lot of conditions. In custody, of course, there are different methods for this kind of a positional asphyxia. It can be any condition in which the person is unconscious and he or she may lie in a position where he's unable to breathe. That again is going to cause the positional asphyxiating condition, and there is restrictive pulmonary function. So acute intoxication by the alcohol or drugs and heart diseases are again going to be one of the causes for this positional asphyxia. Toxicological analysis, the blood samples, of course, they are carried out, the urine samples, they are sent to the chemical pathologist for the assays. And that is going to be the mainstay evidence over here, whether the person has been drugged or alcohol intoxicated or not. Now, the blunt injuries are a common way in which the person is tortured. Heavy punches on the face, nasopharyngeal bleeding occurs after these heavy punches, and air passages blockage. If the person is alcohol, the air passages are blocked in such a case. Reflex cardiac arrest is also one of the causes over here, and the subarachnoid hemorrhages can result in these blunt injuries in such a case. The vertebro-basilar vascular damage is again one of the causes over here. Alcohol is a cause of death in the custody. So we have to keep in our mind that alcohol is one of the cause of death in such a custody. It provokes aggression, and violent resistance is one of the causes over here. Head injuries and ataxias are quite common in a lot of cases, and we have to keep in our mind that these head injuries and ataxias, they can occur after the person is in an alcoholic intoxication phases. Deceleration injuries are also one of the causes over here. It can result in the frontal and the temporal contact brain damage. So it will be on the opposite side of the impact of the injury. The high blood alcohols, they can result in the risk of the coma, central respiratory depression, gross blocking of the trachea and the bronchi. These are the features for the high alcoholic content in the blood, and the low alcoholic content in the blood. Aspiration of the vomitus is the leading cause over here. Choking or the gastric contents on the gastric contents is also one of the leading causes. That is basically the choking on the vomitus. So the person is such in an unconscious state, he can aspirate to vomitus, or he can basically choke on the gastric contents. These are the leading cause on the low blood alcoholic content. So that is basically how it occurs. Suicide in custody. It is also not quite uncommon. Strips of bedding materials or the handkerchiefs are used by the prisoners for performing these suicides. Because of the depressive conditions and because of all the tortures that the person has been subjected to, he or she may commit suicide. The traction on the neck at the low levels are again very important. Sometimes it is an incomplete hanging phenomena that occurs during the suicide procedures. No signs of bruising, abrasions, or struggle occur in such a case. It is distinguished from the homicides, and the homicide strangulation, it encircles the neck, it crossovers the point seen, and level is quite lower or near the horizontal level. Now, the true hanging marks are present in such a custodial feature. Full circus of the skin abrasions and decompressions are again present in such a suicide or such an attempt for the suicide as well. Low suspension, that is the direction of the pull oblique, is again very common. Now, one can never basically avoid the natural causes that can also underlie the deaths in the custodies. Usually, they are cardiovascular during detentions, effect on the blood pressure and the heart rate, adrenaline response, acute cardiac crisis, diabetes, or if there is any pre-existing epileptic conditions, they can also result in the natural causes or the natural causes of the deaths. Asthmatic conditions are also going to aggravate the person. It's basically going to be an asphyxiating condition for such people. So in this section, basically, we dealt with the miscellaneous causes of deaths in the custodies. It can be of the suicidal type. It can be of some natural diseases, can also be a factor that comes into play whenever deaths in custodies occur. So we have to keep that in mind as well. That is the end of this section. Thank you for watching sqadia.com.